I promise you're not in the upside down, even though it may seem like it with YFD doing training on a piece of medical equipment. The reason for this is a story that starts a very long time ago, in a laboratory far, far away. Germany, 1953, right around the time Swanee got hired on the department. Dr. Holger Hess, an anesthesiologist, Dr. Henning Ruben, invented what they called the ambu bag. This device revolutionized the art of ventilating patients who have stopped breathing or whose breathing was deemed inadequate to support life. The design had, for the most part, remained unchanged for over 70 years. This device has one flaw that until recently was something deemed relatively insignificant. When squeezed completely, this device gives up to 1,500 milliliters of air under positive pressure into the lungs. So what's the problem? Well, take a guess on how much air an average-sized adult needs with ventilation. If you said around 500, then you already know why we are making this equipment change. The consequences of overventilation are numerous and include injury to lung tissue, pushing air into the stomach which can cause vomiting, and overpressurizing the chest cavity, leading to a drop in the amount of blood the heart can pump. The evidence is clear. We struggle to consistently deliver the correct amount of air when using this device, primarily by squeezing too hard and overventilating. So what are we going to do about this? The Youngstown Fire Department is one of the first in our area to make a change. We are putting butterfly BVMs into service on all trucks. This device allows you to set the amount of air you are providing and restricts overventilation. It also can be set for pediatric sizes all the way down to newborn. This means one BVM for all patients, eliminating the need to carry multiple devices. This chart shows the average volume of air the device gives with the different click settings. The more frequently used adult settings are in the red boxes. Okay, I promise we are almost finished. You're probably saying to yourself, for God's sake, it's one piece of equipment. How long can this take? My answer? Less time than a Captain John Racco story. And with much less jazz hands. So let's turn this over to LT Palmer to finish things up.
Okay, so now let's talk about the device itself, the parts that come with it, and then we'll get into how to use it. And so whenever you're going to use this BVM, it's going to be stored in the compartment of our EMS bag that has our airway and our oxygen stuff. It's going to be the middle compartment for right now until we possibly get our new bags. But when this comes out of the bag, it's going to come out of this bag here. It's going to have the BVM itself. It's going to have some oxygen tubing. It's going to have an adult mask, and it's going to have an elbow. Now, this cardboard piece of paper will be located on the BVM itself when it comes out of the bag, and it's going to look just like that. The reason for this is it gives you one instruction that you need to do anytime you're changing the settings on the BVM or using the BVM for the first time to change the setting. All you need to make sure you do is squeeze the BVM itself and then change the setting. So that setting is right here. That setting is the either age or the size for the adult that you're going to set this at. Now remember, according to the instruction, you're going to squeeze it in first, and then you can make your adjustments here. This right here, the PIP, this is like a pressure relief valve. This is set at 40 when it comes out of the bag. That is exactly where we're going to keep it. All of our other ambu bags, all of them are set at 40. They just don't have the ability to change if needed. Down the road, if we do some other things, that's something that we might be messing around with for certain patients. But for right now, don't even worry about this here. As far as the elbow is concerned, you only really need this if you need to change the angle with ventilations. Traditionally, you would attach it like that, and you would ventilate right over top your patient. If for some reason you needed to change the angle of the ventilation, this just gives you some options. It allows you to put it to the side. It allows you to go up and down upright. So now let's talk a little bit about oxygen. Now, this device can have oxygen hooked up to it. This is the tubing that comes with it. This O2 tubing would be connected right here. There is no reservoir bag because the device itself acts as a reservoir. So 10 to 15 liters per minute of oxygen running through this will accumulate inside of the bellows here and be given every time you give a ventilation. Attach right to your low pressure port here, run it 10 to 15 liters per minute, and you're good to go. Just remember, you have to be an EMR, an EMT, an EMTA, or a paramedic in order to use oxygen with this device. If you just have a CPR card, you can still use the device. You just cannot hook oxygen to it.
So there you have it. I guess I was wrong about the jazz hands. Didn't think you could out-jazz hand Racco, but Palmer sure gave him a run for his money. Any questions or concerns, don't hesitate to contact LT Palmer or your battalion chief.